All three people, middle-aged, they had sort of between 20 and 25 years of type 2 diabetes, most of them 5+ years on insulin and big doses like 60 units sort of thing. And it took a maximum of 18 days to get off of all their insulin.
A maximum of 18 days. That's incredible.
It was ridiculous how quickly they got better. And the schedule we used, because we had to protocolize it somewhat, is 24 hours fasting 3 times a week. So this is the thing, is that within, less than a month, they had significantly reversed their type 2 diabetes. Even a year later, I think 2 of them are off all meds and non-diabetic by the classifications, by A1C.
Mm-hmm.
And one of them, I think, was on some metformin still, but came off all the insulin and 3 out of the 4 medications or something. So doing ridiculously well for an intervention that is actually free, available to anybody, and has been used for thousands of years. So it's sort of ridiculous how quickly some people can get better. And, as I was saying, it's like this is something that really people need to understand, because it causes so much disease, type 2 diabetes. I mean, 20 years of diabetes, and we had just proved that was all completely unnecessary. Like, do you know the amount of damage they did to their bodies with 20 years of type 2 diabetes?
Yeah.
To their hearts and to their kidneys and to their eyes.
And it was all completely preventable.
Exactly. Like in a month, they could have taken care of the whole thing.
And that's why you almost have to take, matters into your own hands. You have to take your health into your own hands, because you're not going to hear it from the media. You're not going to hear it from the doctors. And sometimes you gotta do that, because just like Dr. Davis, I get emails from people. They say, "Oh, thanks for writing the book. I listened to you. I lost 30 pounds. I got myself off of insulin. My A1C is now normal, so therefore, by definition, you're not diabetic." And I think, okay, that's great. And then I always think to myself, which I don't say to them, I always think to myself, why did you have to do that despite your doctor? Not because of your doctor, but despite your doctor. And that's a very, very, very sad statement on the affair of things. I had a patient once who I saw in the IDM clinic. They were doing great. They lost weight. They were on insulin for 20 years, and I got them off in like 4 months. It was ridiculous. And their A1C was normal. So again, non-diabetic. And she was like, "Oh, I'm so happy." She went to her endocrinologist, who's a diabetes specialist, and he says, "Oh, good job." And then she told him he was fasting, and he screamed at her. Right? It's like, oh my God. Like, any fool can see that this lady was so much healthier, and yet you go to your specialist, and they tell you, no, you should stop what you're doing, which is making you healthier, and everybody can see that, and go back to your diet that's going to make you sick and diabetic, which is going to lead to your amputation and your kidney disease. It's like, sometimes medicine is just such a logic-free zone. It's like...
Who told you must have a breakfast in the morning, a lunch in the afternoon, and evening? Nothing. Whenever you feel hungry, you eat something. When you don't feel hungry, don't eat nothing. So eating in the olden days, one pediatrician killed a lot of children in America. He said, time feed a child. 2 o'clock, breastfeeding. 3 o'clock, something else. 4 o'clock, something else. Then when a lot of children died, he said, "I'm sorry. Child knows when it wants food. It cries. Feed it. Don't overload it."